All right, so I am here with my patient coordinator, Tammy. Hi, Tammy. How are you?
Nice, Bill. How are you?
I'm doing good. So I've got a couple questions, and hopefully you can help me. I mean, I've been doing a lot of research online. This is something I've struggled with for a long time since I was a kid. I've got a nice widow's peak that's been with me my whole life, and it's starting to get thin in the back now. So I'm trying to do things at a young enough age that'll hopefully prevent me, one, from being completely bald, because again, as I said in my earlier video segment, I don't think I'm going to look great bald. I think I'm going to be one of these guys that can't pull it off. So, I've done some research on a couple things. I know that you guys offer the FUE, the follicular unit extraction, which is an interesting word, and then Neograft is something new that I've been looking into as well. What is the benefit to the FUE or the Neograft type procedure? Are there good benefits versus, I've heard of stripped and other extraction methods, so, what are the differences?
That's a very good question. Basically, when we do the Neograft procedure, we're going to be using hair from the back of the head, which is what we consider our donor site. The donor hairs are then taken, periodically they're removed and suctioned out, and then they're going to separate the actual follicles between 1 and 4 hairs. Each hair follicle can have 1 to 4 hairs in it.
Okay.
So then they actually take those hair follicles and they separate them. Once they've done that, they're going to bathe those actual hair follicles in the platelet gel for you, and that's going to help with the actual transplant and help that tissue to regrow.
Oh,
so once they've separated all of that, they're then going to move to the front area and work from the hairline back to actually transplant those hairs for you.
Oh, very cool.
The benefit of doing it that way is that you're not going to have an actual surgical scar from where a strip is going to be removed and
I've
then
seen
transplanted.
That. Yeah.
Yes.
I'm not
Yes.
interested in any type of scarring. Downtime. Is there a difference between the procedures, or
Yes.
what's the benefits to? I think some of the things I've read about Neograft is that it's the very minimal downtime.
Yes.
Is that true?
That is very true.
Okay.
So you can basically return to work within 24 to 48 hours after having the procedure.
Wow.
It is something where you're going to have minimal discomfort associated with it. And the actual procedure itself, when you have it done, because they're not making any type of surgical scar,
Right.
you're going to benefit by that by, again, having less downtime and time away from work.
That would be good. Not a lot of time from work off is going to be really, really good. So, okay. It sounds good. It's everything I've been reading about. What's the next step?
Well, the next step would be to determine if you're an actual good candidate for the procedure.
Okay.
We want to make sure that you do have enough donor sites or donor hairs to address the areas that you want to actually put more of that hair into.
Perfect.
Okay? So